You need to watch this if you struggle with acne. Please subscribe to our channel for more tips. Acne. Just the word can bring a wave of frustration and self-consciousness. Millions of people, especially teenagers, battle these pesky blemishes daily. It's a common skin condition that can affect anyone, regardless of age or background. But don't despair. Clear skin is achievable, and we're here to guide you. Acne isn't just about pimples. It encompasses various skin imperfections, from blackheads to whiteheads, and even painful cysts. It's a condition that can impact your self-esteem and make you feel less confident. But remember, you're not alone in this fight. There are effective ways to manage and treat acne. Effective acne management starts with understanding what you're dealing with. Knowledge is power, and in this case, it's the power to reclaim your clear skin. We'll explore the different types of acne, the science behind breakouts, and the most effective treatment options available. This journey to clear skin requires patience and the right approach. We'll provide you with practical tips, home remedies, and advice on when to seek professional help. So, let's embark on this journey together and banish those blemishes for good. Acne vulgaris, the medical term for acne, is a skin condition that arises when hair follicles become blocked with oil and dead skin cells. This blockage creates a breeding ground for bacteria, leading to inflammation and the formation of various types of blemishes. Understanding these different types is crucial for effective treatment. Comedonal acne is characterized by blackheads and whiteheads. Blackheads, also known as open comedones, appear dark due to oxidized oil and debris. Whiteheads or closed comedones are small, white bumps beneath the skin surface. These are the initial stages of acne and can often be managed with topical treatments. Inflammatory acne, on the other hand, involves more severe blemishes. Papules are small, red bumps, while pustules are pus-filled pimples. Nodules are larger, painful bumps beneath the skin, and cysts are deep, pus-filled lesions that can be quite painful and lead to scarring. Recognizing that the type where acne you was so what you have can help you choose the right treatment strategy. While some over-the-counter products may be effective for mild comedonal acne, inflammatory acne often requires prescription medication. Consult a dermatologist for accurate diagnosis and personalized treatment. 4 key factors contribute to acne: excess sebum, clogged pores, bacteria, and inflammation. Understanding these helps in prevention. Sebum keeps skin moisturized but can clog pores. Clogged pores trap bacteria, causing inflammation. Regular exfoliation reduces breakouts. Section 4. Battling blemishes. Medical treatment options. A range of medical treatments are available to combat acne, from topical creams and gels to oral medications. The choice of treatment depends on the severity of your acne and your individual skin type. Always consult a dermatologist for personalized recommendations. Topical treatments are often the first line of defense against acne. Benzoyl peroxide kills bacteria and helps unclog pores. Retinoids, such as adapalene and tretinoin, normalize skin cell turnover and reduce inflammation. Topical antibiotics reduce bacteria and inflammation, but are often used in combination with benzoyl peroxide to prevent antibiotic resistance. Oral medications are reserved for more severe or persistent acne. Oral antibiotics, like doxycycline, can help reduce inflammation and bacterial growth. Combined oral contraceptives can regulate hormones in women, reducing acne breakouts. Spironolactone, an antiandrogen medication, is another option for women. For severe or treatment-resistant acne, isotretinoin may be prescribed. This powerful medication can significantly reduce acne but it requires close monitoring due to potential side effects. Other treatments include injectable corticosteroids, which can reduce inflammation in individual lesions, soothing your skin naturally. Home remedies can complement your skincare routine and provide soothing relief. Orange peel and milk help unclog pores and reduce inflammation. Multani Mitti absorbs oil and soothes skin. Aloe vera and turmeric hydrate and reduce inflammation. Besan and yogurt exfoliate and calm the skin. Section 6. The dermatologist's role and patients in treatment. Consulting a dermatologist is crucial for effective acne management. A dermatologist can accurately diagnose your acne type, recommend appropriate treatments, and monitor your progress. They can also address any underlying skin conditions that may be contributing to your acne. Patience is key when it comes to acne treatment. Results aren't immediate, and it may take several weeks or even months to see significant improvement. Don't get discouraged if you don't see results overnight. Consistency with your treatment plan is essential. Avoid picking or squeezing pimples, as this can worsen inflammation, increase the risk of scarring, and spread bacteria. Resist the urge to touch your face, as this can also introduce bacteria and irritate the skin. Establish a gentle skincare routine using mild cleansers and moisturizers. Avoid harsh scrubs and cleansers that can strip the skin of its natural oils and exacerbate acne. Sun protection is essential, especially if you're using certain acne medications that can increase sun sensitivity. Section 7. Achieving clear skin. Your journey starts now. Your journey to clear skin begins with taking the first step towards understanding your acne and seeking appropriate treatment. Don't let acne control your life. With the right approach, you can achieve the clear, healthy skin you desire. Remember, you're not alone in this battle against blemishes. Millions of people experience acne, and there are effective solutions available. Empower yourself with knowledge and seek professional guidance when needed. Consulting a dermatologist is the best way to get a personalized treatment plan tailored to your specific needs. They can provide expert advice and recommend the most effective medical treatments and skincare practices. Be patient and persistent with your treatment. Don't get discouraged by setbacks. Consistency is key to achieving long-term clear skin. Start your journey to clear skin today and embrace the confidence that comes with a healthy, radiant complexion. Visit our website for more tips and connect with a dermatologist to begin your personalized skincare journey now. Don't forget to subscribe for more content.